Dr. X, retired dentist. You've been having this hurt for about 3 weeks?
Yeah, approximately.
It hurts whenever there's pressure on it?
And it aches after.
And it aches after walking around?
Yeah.
What we see when we look at it is a little tiny black dot, just like a millimeter or two, with a little surrounding brown collar. And it looks like it might be a little raised. You know, you can see a little white around it. I do not know what it is, but it's hurting you, and I have the power to remove it.
Man with the power.
So I'm going to use some lidocaine with epinephrine, buffered with some bicarbonate, so it doesn't sting as badly. Here we go. Sorry. And I do inject slowly. We're seeing some blanching of the surrounding tissues as it fills up with lidocaine with epinephrine. Epinephrine, being a vasoconstrictor, will constrict the arteries coming in, so there's less blood flow. That does a couple things. One, it makes for less bleeding during the procedure, and it also helps to let the anesthetic stick around and do its job longer. Steady myself. I haven't had caffeine, I'm just shaky, that's all. Does that make you feel better?
That you're shaky?
That I'm shaky?
No, actually it doesn't. That's not reassuring.
Oh, too late now.
Never admit to the patient and never say whoops.
All right. Get a hold of that sample there.
That's the tricky part, is cutting it loose. It's full pedicle.
So what does a dentist say when seeing that we do get patients who can't get into their dentist right away?
I think you did fine. I think you did as best you could. I think no, a dentist couldn't have done any differently.
Thank you. That's a big
compliment. The problem with draining an abscess is a couple of things. You can't go injecting directly into an abscessed area. First of all, it's not going to do any good. Secondly, we might lead to a cellulitis. And, so you're kind of between a rock and a hard place, but you want to give relief to the patient. That thing looked like it hurt like the devil, because it gets under the periosteum, which is incredibly sensitive tissue. And you did a service to the guy. You got him out of pain, I'm sure, and you kept the abscess from spreading further before he could get into a dentist.
Yeah. Thank you for extra consultation there. There, that's better. So there are actually two of them in that little space there.
Okay,
which
that'll probably be more.
Might need a little Band-Aid just to get whatever. Thanks for joining us. We actually did have a retired dentist, Dr. X, join us.
Dr. X.
And give us commentary on Dr. Gwain's abscess video. If you haven't seen that, just click on the card that promotes it during this video, and you can see what we're talking about. Thanks for joining us with this. If you haven't subscribed already, there's lots of videos that we have. You don't want to miss them, so make sure you're subscribed. Share with your friends, comment, like. Until next time, this is Dr. X.
Is this X-rated then?
I guess so. Did you tell your wife you're going to be in one of those movies?
No.
Hey, thanks for watching. That was a really cool removal of what turns out to be a foreign body on pathology. We found that it was partly polarizable plant material. In other words, a thorn that got stuck in his heel. If you haven't already, please do subscribe and tell your friends and share with them and comment and like the videos. Until next time, this is Dr. Mark Vaughn telling you to stay in good health.